Hey students, by the end of this video, you'll not only understand how to give a hip injection, you'll actually see it done step by step in real practice. Let's get into it. Alright students, today we're going to learn how to properly administer an intramuscular injection in the hip, also known as the ventrogluteal site. This is one of the safest and most recommended sites for IM injections. First, make sure your patient is positioned comfortably, either lying on their side or slightly turned. Always explain the procedure to your patient before starting. Now, let's locate the correct injection site. Place the palm of your hand over the greater trochanter of the femur. If you're using your right hand on the patient's left hip, or your left hand on the patient's right hip, it will feel more natural. Next, point your index finger toward the anterior superior iliac spine and spread your middle finger back along the iliac crest. This creates a V shape. The injection site is located right in the center of that V. Once located, clean the area using an alcohol swab and allow it to air dry completely. Hold the syringe like a dart, stretch the skin slightly, and insert the needle at a 90-degree angle in a quick, controlled motion. Depending on your clinical guidelines, you may need to aspirate before injecting. Then, slowly and steadily inject the medication. After injection, withdraw the needle smoothly. Apply gentle pressure with gauze. Do not rub the area. Finally, dispose of the needle safely in a sharps container and observe your patient for any reactions. And that's how you perform a safe and effective IM injection in the hip.